Bismillahirrahmanirrahim. Assalamu alaikum. Good evening, everyone. A very good evening and welcome. Welcome back again to the platform, the wonderful, the knowledge platform for you. And as you know, we are studying, we are training, we are educating, we are just doing a one free course which we just offer you by from the Ask platform. It's dietary and lifestyle changes, lifestyle modification. So from 4 days, we are just starting this one, and we are just trying to discuss some particular things to how you can just modify your lifestyle, how you become, how to change your habits. So if you are really want to work on your lifestyle, if you are loving yourself, if you love your body, if you love your environment and you really want some changes, so how you can do it. So we are discussing, we just covered three topics. So today we are going to discuss something more. Actually, we are trying to cover up some certain things because we want some knowledge from basic to from the scientific one. Okay, so we're just going through from one by one. We are discussing some certain things which is related to typically our lifestyle, our habits, and our environment where we are living, our home, our workplace, and the place where we are just growing for ourselves. So today we are going to discuss something more because everyone is not on same. So we are just going to discuss something more. Uh, the most important thing is prevention because the preventing is more better than the cure. We will discuss it more. Hopefully, we will discuss more about this one. So today I'm going to explain to you. Today I'm going to talk with you about the work which is done by the World Health Organization. It's a World Health Organization. We call it a department. We call it a global department. We call it a association or something, which is working globally uh, for our health, for the disease, for the controlling, for the prevention, and this organization is work globally. It's not typically doing for any particular country, it's doing it globally because there is some implementation from this organization. We have to discuss it because when they put some rules, some regulations, some implementation from all around the world, all around the globe, and for all countries. So it means these things are very serious, and we have to do work on those situations. So the World Health Organization is a specialized agency of the United Nations responsible for international public health. Public health. We are public. We are all public. We have to understand the situation. We have to understand which whatever they want us. So we have to accept it because it's for our safety. It's for ourselves. So whatever they will say, we have to understand it. As you just saw, is in a pandemic situation after this corona separation, when it starts separating from one country to another, then this organization, World Health Organization, put some restrictions, and after that we followed, and they strictly they implement these uh, restrictions, and that's and they you have to follow. So after the putting these restrictions, we just saw that how we control this disease in just few days. So if this organization is announcing anything, it means it's a bit serious, and we have to go with it. The WHO Global Strategy on Diet, Physical Activity and Health, because Diet, physical activity, and health. If we will discuss it in the prevention as a prevention, so the topic and the examples and the abbreviation and the definition is bit different. Before disease and after disease, there are two situations: before disease and after disease. Like you are living in a healthy environment and you are aware of everything and you are preventing. You don't want to get sick. You don't want flu. So, you know, in your around, there is a chance you can get sick because there is a suppression of flu virus. So if you will start working on the prevention, so it means you are living in a healthy environment and you are taking care of yourself. So the definition is a bit different. And if you are get caught, if you are sick, now you are sick, you got the flu, so that now situation is different. Now your environment, where are you living, in room, home, workplace, is not safer for others as well because it's spreading one by one to another. So if we work on prevention, so it means it's better than cure. Okay, so about this diet, physical activity and health was adopted in 2004 by the Health Assembly. Actually, this bill passed, and the strategy called on governments who internationally partner the private sector and civil society to take action at global, regional, and local levels to support healthy diet and physical activity. Why? Because we don't want to get sick. They don't want that everyone on the globe, everyone all around the world, everyone who is living with us, they don't get sick. Because if there is a one person gets sick, it means that disease is existing on that particular area. Now it will spread. So what we are doing? We are putting prevention. We are implementing the rules of prevention. So that's why this organization put made some rules and put some restrictions, and they informed us through their governance, through the strategy that you have to eat healthy food, you have to consume uh, approximately 3 liter water a day, you have to do some physical activity if you want to live on the natural state. And I told you what is the natural state. So in this situation, this organization is helping us not the directly by our governments. So from the world, from our governments, and then the local departments. But the strategy is same. If we just discuss these days, there is a chance of spreading uh, maybe this malaria or dengue fever. So there is a chance because now it's an ideal environment for that particular pathogens, that particular mosquito to develop itself, and it's just to spread this disease in the human beings and as well the other living organisms. So for this particular thing, we have to work to stop it before it's spreading. So the local authorities is working on it with the help of World Health Organization. So keep in mind whenever this organization is announcing something, so its mean is bit serious. So we have to take it seriously. So the WHO response, like in 2010, the Health Assembly, the same organization, Health Assembly endorsed a set of recommendation on the marketing of food and non-alcoholic beverage to children. That don't sell this kind of thing to the children under the age of, and this recommendation guide countries in designing new policies and improving existing one to reduce the impact on children of the marketing of food and non-alcoholic, which food is unhealthy food, which is not good for their health. as we discussed before, that if we are educating our children, our kids, on the level of when they are growing up, okay, on the level when they are growing up, so it's more easier because after the some time it's become their habit. Okay, so the same that who response that you have to do. In 2012, the Health Assembly adopted a comprehensive implementation plan on maternal, infant, and young child nutrition, and six global nutrition targeted to be achieved by 2025, upcoming in 2 years, including the reduction of stunting, wasting, and overweight in children, obesity, like if they are not consuming a healthy food, if they are eating too much, they are not doing extra any physical activity, they are just sitting, eating, and playing games on mobile phone or on the other gadgets, and so it means they are going to be overweight. So in for our society, we need a healthy person. We need a healthy society. We need a healthy environment. So we have to work on ourselves, the people who is living all around us, and especially on the children. The improvement and the reduction. So we have to plan it. So because we are busy in our daily routine life, we're doing so many activities. So that's why this organization help us. So they provide us the rules, the very simple rules, how you can spend your 24 hours, how you have to do work, if you are sitting at your home, if you are sitting at your workplace, how you can do it, the things. So they are here to help us. So we have to listen them. We have to adopt. We have to work whatever they are saying. Because now we are believing as a human being, as a public, we are believing that whatever they are saying is correct, and we have to understand it. We have to adopt that thing which they are saying. In 2013, the Health Assembly agreed to nine global voluntary targets for the prevention and control of NCDs. These targets include a halt to the rise in diabetes and obesity, with many countries now seeing a rapid rise in obesity among infants and children because we are not adopting a proper healthy rules, even for ourselves, even for our children. In November 2014, who organized jointly with the Food and Agriculture Organization of the United Nations the second international conference in nutrition. Why? Why they are doing? For ourselves, for the public, for the safety of the public. Is for the prevention. We, you know, prevention is better than cure. After obesity, after the heart disease, after a cancer, is it better? Or we are doing prevention to doing some small things and we just save ourselves. We just save ourselves from these chronic disease. After getting this chronic disease, we will, how many years we will survive? How many years we will live? Because we know some some diseases are not controllable, some diseases are not curable. So it means we have to follow the safety and healthy rules, which is once by the WHO, World Health Organization. It's for us. Okay, so we have to work the same strategies. So still WHO responses in May 2018, the Health Assembly approved the 13th General Program of Work, which will guide the work of WHO, reduction of salt sodium intake, and elimination of industrial produced trans fats from the food. Salt sodium intake, so it's a bit dangerous for whom? For the heart patients. The trans fat is for the obesity. So they work for whom? For us, for the public, because they know we are consuming, we are lazy, we are not eating a healthy food, we are not trying to get organic and pure food. So they know it because the most people all around the world, because they are busy in their routine life, so they don't take care. They don't take care about their health, so that's why they work on it for us. And after that, they put some rules, and they work with the organizations, with the industrial organizations, to work on the salt, sodium consumption, and the trans fat, which is which we can found in our processed foods, which we are buying from the supermarket. These are stored processed food, which is not, or we can't say it's not original, but it's not on that natural state. It's not pure. It's not on time used food actually, because there is a certain time period when we are just buying something from, you know uh, something organic things, and there's a certain time period to use it. So to support member state in taking necessary actions to eliminate industrially processed trans fat, who has developed a roadmap for the countries, even for the general public, even for the countries, but even for the general public, there's a rules. So please, if you can, if you can buy our organic and pure and fresh things. If you can't, at least eat some fruits in your daily diet. Consume some fresh vegetables. Try to consume some nuts, some dry fruits. Try to consume more and more water. Try to consume milk and some organic ingredient for yourself, to just maintain your health on the natural state. So this department is, they are giving us some strategy how we can make our a plate a healthier plate, to convert our daily food things in a healthier state. So they are working for us. So it means we have to accept it, and we have to go with it. Okay. So I'm just trying to provide you some key facts. I just try to provide you some ideas which this organization is working, because they are working for us. So we have to, we have to go with them. We have to adopt these rules and these habits to for ourselves, to make our health better, to make our environment healthy. Okay, so healthy diet helps to protect against malnutrition in all its forms. Unhealthy diet and lack of physical activity are leading global risk to health. I told you, if there's a one person sick, it means your environment is sick, because there is a chance the disease will spread. You can see, if there's a one person in your family, he just got flu, and that person is not taking care of that environment, and is sitting with you using some, the tissue papers and plates, cups, or something, and you it's just putting all around. So the other member of the family get easily the same disease, because there's a separation. It's spreading. We are not taking care, so it's spreading. So it's go from your home to another home, because you are moving from one area from to another area. So it's spreading. The same the chronic disease. If there is like we from our childhood was, we are listening about the HIV/AIDS. So there is some restrictions. If we will not follow, so it will easily spread. So healthy dietary practices start from early age, early in life. Okay, so it become our habit. After using bathroom, you have to clean your hand. Even doing anything, even from cleaning, driving, coming from outside, first come and clean your hands with the proper antibacterial soap. Clean your face. Okay, so these small things, which if becomes your habit, it will save you from very risky, chronic, and dangerous disease. It's a very small thing to just to cleaning hands. So, so this the World Health Organization, even our local authorities, our governments, they are working for us just for ourselves, just to inform us that there is a someone. If you are not taking care of yourself, you are putting yourself and your environment on the unhealthy state. Energy intake calories should be in a balance with an energy expenditure. If you are doing healthy work, physical work, like extra physical work, so how many calories you need. If you are just sitting on the chair, then what should you do? How your food should be like. To avoid unhealthy weight gain, total fat should not exceed 30% of total energy intake which you are eating in the form of calories. Limiting intake of free sugar to less than 10%. We just studied that extra fat in the industrial material, in the industrial food items which we are consuming. So we have to watch, the diabetes, the two type of diabetes, type 2 diabetes. So it's spreading because of if we are not eating a healthy food and we are not doing any kind of physical activity. So keeping salt intake to less than 5 gram per day. Okay, so they are providing us the limitation with the sugar, with the salt, the activity. So so it means now we know it. We have 24 hours, so it means we have 5 gram intake of salt. So we have to consume how much we have to consume the sugar because the, the sugar is not like there's a separate thing or separate ingredient or item. The sugar is in everything which we are consuming. There's a juices, there's a fruit, there is any other item from the bakery or anything with whatever you are. So there is a some kind of there is a part, less or more, but there is some salt and then there is a sugar. So you have to whatever whenever you are just going to buy something, there is a literature you have to study it. The WHO means World Health Organization member states have agreed to reduce the global population's intake of salt by 30% in 2025. Okay, so there is the consumption of salt. If I'm just going with as we are consuming sodium chloride in our daily routine, in our food, uh, in we are using this salt in every kind of food. We are using it. So they already inform us that you have to eat a 5 gram per day. So if we just calculated that how much we are consuming in a day, but in a different portion of food, is it more than 5%? Is it more less than 5%? So this department is not going one by one in every house and they are watching that how much you are doing. They are giving us the education. They are providing us the information. Okay, they are just giving us with the example, with the clinical trials, with the lab testing, the real life examples that if you are going to consume these things in this portion, so this thing will happen. If you are using too much sugar more than your need, so you will be a patient of diabetes. So and you know it very well, it's not curable. So who is responsible? You, because there's already announced that in your daily intake you have to consume this much. So that's why I just discussed with you some key facts because our topic is repeating from day one to up to now. We are repeating the same thing. The sources is different, the topic is different, but the things are same. Food, health, unhealthy conditions, environment, daily activity, the exercise, the physical activity. So it means we are repeating for whom? For you, for myself, for yourself. to just inform you, to just guide you, to please work on your body and come on the real natural state. Okay, as per WHO means World Health Organization, because today we are just working, we just studying globally that how our organization providing something from from his side, from the organization side to everyone, not only for our country, for everyone, all the countries in the world. For adult, a healthy diet includes the following: fruit, vegetables, nuts, grains, these all things, not every time, not in the breakfast, not in the your dinner, not in your lunch, brunch, but you have to eat fruits, vegetables, because in the very beginning I told you we need some nutrients, we need some vitamins. Okay, so how we can get those vitamins? Okay. So from these things, fruit, vegetables. So as per if you are adult, so the quantity is different. At least 400 gram, 5 portion of fruit and vegetables per day. 400 grams. As we just studied that you need 5 gram salt in a day, so same we need a 400 gram fresh fruit and vegetables per day to get those nutrients, excluding potato, sweet potato, because there's some particular fruit and vegetables which we are getting. There's a particular, because in every fruit there's a different nutrients, in every vegetable there's a different nutrients. So that's why I said in every season whatever the fruit and vegetable is available in the market, you have to consume, because in every fruit, in every vegetable there's a different nutrients. So less than 10% of total energy intake from free sugars, which is equivalent to 50 gram or about 12 level of teaspoon for a person of healthy body weight, consuming by about 2000 calories per day. For whom? Body weight consuming, healthy body weight consuming. Not for every adult, because there is a different position, a working position. Are you doing any healthy physical activity, or are you sitting all the day on the chair? So it's from 1400 to up 2000. So if you are consuming 2000 calories with the 50 gram of sugar, it means you have to do extra physical activity. Less than 30% of total energy intake from fats, unsaturated fats found in fish, avocado, nuts, sunflower, soybean, canola, olive oil. You are using these things in every routine of your life, maybe 2 or 3 times. So you need a day a 30% of this fat, this total fat, again healthy body weight consuming under 2000 calories, including both industrially produced trans fat found in a baked and fried foods, or you can found in other ingredients. We just said that avocado, nuts, and other things. So less than 10% of total energy intake in a trans fat to less than 1% of total energy intake. Just put this situation, the 2000 calorie a day. In particular, industrially processed trans fat are not part of a healthy diet and should be avoided, because they, if you are consuming these fats, you need 30%. But the same time, you need a food with a portion, a complete meal for your body. So from this unsaturated fat, from the small amount, and you get extra 600 to 800 calories. So it means you are not providing fully meal which your body needs. So you are not providing it. Less than 5 gram of salt per day. Salt should be iodized. Salt should be iodized or not. Actually, it's a complete topic. I just put this thing to let you know. You have to, if you get time, you have to just check with your physicians, some professionals, even with the Ask platform with us, that salt should be or not iodized. Iodized salt is for you or not. There is some certain condition and stages. So we will discuss it with any other course or in any other topic. So for now, for you is a 5 gram of salt per day is your body need and the recommendation from the WHO, World Health Organization, for adult person. For infants and young children in the years two with the first 2 years of child life, optimal nutrition fosters healthy growth and improves. It also reduces the risk of becoming overweight. We just in the, before some slides we just discussed these things. Okay, so you know it. From the infant to the growing children, you have to provide them a very healthy food. And for the physical activity, they must do it. Because if you don't want that your kids, your children are not get obese and they're not going to become overweight, advice on a healthy diet for infants and children is similar to that for adults. But the following elements are also important. The condition is same for the adult, for the infant. For both, we need a fresh fruit with the same amount of vegetables, sugar, fats, salt. Infants should be breastfed exclusively during the first 6 months of life. Infants should be breastfed continuously until 2 years of age and beyond, because it's a recommendation. It's a need. It's a need of that infant's body. So ignoring of this thing and providing a infant some kind of medicine, some the, like in our daily life, what we are doing, we are just skipping this thing, a breastfeed, and providing this kid that the infants uh, from we're buying some some material, some ingredient from outside and providing this the infants, and we are just imagining that this artificial, the lab made, the industrial made product is better than the breastfeeding, the milk there, which is a pure, natural, and on the healthy and natural state. There is a certain conditions. I'm not going to discuss it more because this is not our topic, but but from the World Health Organization is a recommendation, and you can say it's a restriction. You have to do it until 2 years. From 6 months of age, breast milk should be complemented with a variety of adequate, safe, and nutrient-dense food. Salt and sugar should be added to complementary food, starting from the 6 month, next 1 year, next 2 years. So it's going step by step. If you want that the kid, your child are healthy, so you have to work on it. If you will ignore it, if you will skip it, so you and your kid will face the consequences. So please don't ignore these things. Okay, how to promote healthy diets? We are just discussing. So there is something how we can promote it for ourselves, for others, for our friends, family, our circle, wherever we are living. Diet evolves over time, being influenced by many social and economic factors that interact in a complex manner to shape individual dietary patterns. We need these dietary patterns, but we are busy in our daily life. So what we should do? We just follow the WHO, World Health Organization rules, which is very small rules we just discussed. You just have to worry about your plate. You just need a healthy plate, so you have to worry about your plate, what you are eating. These factors include income, food prices. These things are involved from our government level, because as we are on living on that environment, if something which is we can't afford it, so so there is anything alternate on it. If we can't buy a orange, so there is some other citrus fruit as well. I'm just giving you example. If you can't buy something, so there is anything an alternative, not a medicine, not a processed food. Okay, in a nature, we are not having a few veggies and fruits. There's a variety, so we can go it. If there is there's a one thing is unavailable and we can't afford it, so there is something else. Individual preferences and beliefs, cultural tradition, the geographical environmental aspects. These are the factors which I think which is not against, but in some condition it against it. Okay, so therefore promoting a healthy food environment, including food system that promote a diversified, balanced, and healthy diet. Governments have central rules in creating a healthy food environment that enable people to adopt and maintain healthy dietary practices. You are just going on the street, on the road, and you just saw there is someone is just selling some kind of food, any kind of item, okay, which is smells good, maybe the taste is also very good, and you just buy it. So did you just observe that he is selling that food on the street, and that street, that road is full of dirt. It's not clean. So when the air is blowing, that dirt, some sand or soil particles, and there's other particle is just that there's a part of that food. So maybe there is some kind of germs is all around the plates, spoons, glass, or something which he is using. Maybe he's not cleaning it properly. So is it that food is healthy for you because you are going to use that food for your tongue? You just smell it and your mind said, "Oh, the smell is good." Then your mind said, "So this food should be tasty for your tongue. So go and eat it." But there's a situation in your stomach after consuming that food. So prevention is better than cure. After eating that food in few bucks, in few rupees, and after get sick and you just go to the hospital and paying extra money to cure that condition, that disease, which is because of that food. So tell me, are you intelligent or you are fool? Prevention is better or cure is better? Healthy food is better to controlling yourself to eating unhealthy food is better, or consuming that food is better? Everything you know it. You know it, I know it. It's every day we are just watching on the TV, on the social media, in newspapers, in our topics when we are just discussing in our friends, family, in our working environment. We know it. We know this thing is not healthy for us, but we are, this our tongue, we are doing it for our tongue. So that's why I told you, I just trying to give you that this thing. Please don't eat for your tongue. Eat for your stomach. Eat for your body. Governments have central role in creating health and food environment that enable people to adopt and maintain healthy dietary practices. But we are not practicing. You know it. Effective action by policymakers to create a healthy food environment, include the following. Like whenever you are going to buy something, are you checking there's an expiry date? Is it expired or not? Is it open or sealed? Is it for you? Are you allergic with this item or not? Is this food for you or not? So there's something is for you. You have to work on it. The World Health Organization member is not coming at in your doorstep or saying, okay, please, let's together today we will do a shop. Then I will tell you how to you can shop and you have to buy things. No, they already provide you every information. So you have to go and you have to just check everything in your situation, you know. So please, so there's a some more healthy diets promoting, you know, there's a you can say is a tips or a key factor, it's a key that you have to work on it. Is for implementation from this organization, it is a recommendation for marketing of foods, for our dietary practices, okay, the instruments, the national and local food services, okay. So it's from that organization to departments, from the governments, from authority, from the local authorities, and then it's come to our market, and then it's reached on our doorsteps. And from our doorsteps, we are going out to buy this thing, and after consuming, we are facing the reaction of these products. So it's coming from that side or going from our side is the same. So when you will just get these slides, so you have to review it again. So then after that, you just got some ideas that okay, after doing something is in your mind that okay, let me check these things. Okay, so just go again with these slides, please. Encouraging consumer demand for healthy food and meals, promoting consumer awareness of healthy diet, developing school policies and programs that encourage children to adopt and maintain a healthy diet, not in only in the schools, even at the home as well. As a parent, as a guardian, as an elder siblings, please educating children, encouraging culinary skills, including children through schools. Just I told you to clean your hand, very small for few seconds, but you have to clean it. Supporting point of sale information, including through nutrition labeling. Whenever you go out, check labels. Ensure accurate, standardized, comprehensible information on nutrition. Which nutrition is in that product? Is it your need or not? There is a expiry date, so check everything. Providing nutrition and dietary counseling at primary healthcare facility is for you, so you have to check it. Whenever you are going, just check everything. Okay, what is prevention? The action of stopping something from happening to doing before it. I, I give you the example of flu. I don't want to get flu. I don't want to get sick. If my other sibling is just got that flu from outside, so now we have to put some prevention. Okay, please stay in your room. We will provide you some particular food. If you need medicine, we will provide you, but please keep distance because this flu is spreading from you to us, and it will spread all over the family. So please, as a prevention, keep yourself separated for a few hours or for one day to make yourself healthy and even for ourselves and for our environment. So the action of stopping something from before it's happening is not only for the disease, it's for everything. We will discuss it later with our one more topic. So Okay, just go with prevention. Health promotion and disease prevention through population-based intervention, including action to address social determinants and health inequity. Example including legislation of information to ban or control the use of hazardous products. We are using there are some hazard products in our house, in our working environment. So we have to, there are some rules, safety rules, man, mandate the safe and healthy practices, use of seat belt on bike helmets, seat belt driving a car, education about healthy and safe habits, eating well, exercising regularly. So these things is for prevention. If you are going out on the bike, use helmet. If you are going to drive, use seat belt. It's for yourself. It's not for the World Health Organization members. It's for yourself. The members is also following these rules. So it's also for yourself as well. So prevention is better than cure. Disease prevention understood as specific population-based and individual-based. I told you, if your sibling is got flu or any other disease, so disease prevention is better than cure. Primary prevention refers to action aimed at avoiding the manifestation of a disease. This may include action to improve health through the changing the impact of social and economic determinants on the health. Secondary prevention deals with early detection. Early detection. My sibling got flu. Early detection. Now prevention. Disease prevention rules. Distance. Improves the chances for positive health outcomes. These activities such as evidence-based screening program for early detection. You practice this thing after this pandemic situation, after the spreading of corona, you practice it. You know how to disease prevention work. So the same strategies, if you will put on every situation, every health situation, disease situation, so you will save yourself. Health promotions. Health promotion is the process of empowering people to increase control over their health and is determined through health literacy effort and multi-sectoral action to increase health behaviors. This process includes activities for the community as is large, for the population and increase risk. It's just to educate others. Like I'm giving you some information, I'm trying to educate you, so same you have to educate others. So provide your health promotion. It's promotion. So same, you just go and just talk with your friends and family in your circle that you have to consume 5 gram of salt, any kind of salt in a per day in 24 hours is your recommendation. It's your body need, not more than and not less than. Okay, so you have to promote the healthy, healthy literacy, healthy education, information, the trainings, whatever you know, just share with others. Disease prevention and health promotion share many goals, and there is a considerable overlap between functions. On a conceptual level, it's useful to characterize disease prevention services as those primary. So health promotions is not only for you, it's for the public, it's for your environment wherever you are living. Scope of this function, primary prevention services and activities include vaccination and post-exposure prophylaxis of children, adults, and the elderly, provision of information on behavioral and medical health risks, nutrition and food supplementation, dental hygiene, secondary prevention include activities, population-based screening, provision of maternal and child health programs, provision of chemo, prophylactic agents to control risk factors, hypertension like hypertension, some heart disease, some kidney disease, some there's other chronic disease. So after prevention, putting these rules, there is a scope, there is a function, there is a chance that you can control the suppression of this situation, this disease, these conditions in your friend, family, and in your environment. So please go through again with when you just get these slides. Health promotion, sport mechanism for health promotion and disease prevention. We just study about our lifestyle, our behavior, how we are spending our 24 hours, our sleeping hours, our working hours. There's a risk communication. If there's a miscommunication between the organization, departments, governments until us. So what will happen after skipping or ignoring the prevention rules? We will face the consequences, we will face the problems, we will face the condition which we don't really want. Really don't want to go to hospitals, to doctors, to eating medicine and just facing this problem. So I don't really want. So what should I do? I will go with the prevention. I will go with the safety measures. I will go with these rules to just save myself. So it's the same thing I'm sharing with you. So friends, I just discussed you some rules which is governed by the World Health Organization and some prevention tips and techniques, something to just save ourselves from the from some bad situations, some particular conditions which we really don't want. So if you want to be a healthy, you have to follow some certain things which is actually for us. So I hope I make my points clear to you. If there is something still, you can ask me the questions. You can ask me question now or later by sending us email, just putting your question in the groups or in any from any social media. You can just ask our question. You can ask it anything. So again, please, whatever you learn, just share it with your friends, family. So just convey our message, our this information, the knowledge. We just know it. Just share it with others. So if you have any question, please you can ask. We have time, so we can discuss something if you really want it. So we can. So if any question, please don't hesitate to ask. I'm here for you. Today we are just go through our our one topic. We just add some World Health Organization implementation, and we just add up things to discuss more about our life modification and our life habits. So we just discuss more about this topic. So dietary and life changes, lifestyle changes with the proper manners which are governed by organization which is working globally. We're just discussing its implementation. So if you have any question regarding this, please you can ask. You can ask. So I'm here for now for next few minutes. Uh, so I will answer you, but otherwise you can ask us from email or you can ask by in a group. If you want to join us with any other courses which is free, some are paid, you can just contact with the admin team. So if there's any question, please you can ask. And thank you very much that you just joined our lecture. You just pay your time for us. You just pay some your time to get some knowledge, and I really try to provide you accurate, correct, and updated knowledge. But we are not perfect. If there is something you can discuss, you can just point out. So if there is any question, please you can ask. We have time. So if you have a question, please. Okay, let's wait a few more seconds, and thank you very much for your appreciation. And I really enjoyed this lecture. I hope you also enjoyed it. So tomorrow again, because we have some few more topics, three more topics left to cover up this our discourse. So next tomorrow again we will meet on the same time from 8 to 9 Pakistan Standard Time. So with the new topic, we will discuss more things regarding the same course, dietary and lifestyle changes. So tomorrow, inshallah, again we will meet on the same time. And thank you very much to join this course. Thank you very much to spare your time for us. So for now, we are signing off. Thank you very much, everyone. Thank you very much, and Allah Hafiz. Thank you.